So if you take your PrEP regularly, you have the chance of getting the prevention of HIV more than 95%.
So is AIDS curable as of 2025?
The HIV virus, it's a very smart virus. What does it do? It get integrated with the human DNA.
If there is any vaccine that can, reduce the risk of getting infected with AIDS.
In the last few months, I have also read about the many people are getting infected because of the tattooing.
Exactly.
Sometimes hepatitis B, C, eat together, whether you drink together, whether you are hugging, whether you are kissing, nothing can transmit.
So in kissing, for example, saliva is involved.
Yeah.
So can that act as a... Hello and welcome to India TV. I am Shivangi and you are watching Health DNA. Well, in today's episode, we are going to talk about a disease that impacts millions of people globally, yet they do not want to discuss about it. People hesitate because it is HIV/AIDS. And there are many questions inside our mind about this disease, from the simplest ones to bigger ones, like is there any vaccine that can protect us from AIDS? And is this disease curable or not? Now, to answer all our questions, we have with us Dr. Jatin Ahuja, Senior Consultant Infectious Diseases from Indraprastha Apollo Hospital, Delhi. Sir, welcome to India TV.
Thank you, Shivangi.
Yeah. Sir, to begin with, we all know about AIDS. It is an autoimmune disease and we know how it gets transmitted sexually and from blood infusions, etc. But what we do not know is about these symptoms that often go untreated. People do not understand that these might be signals, but later on they might turn out to be something very big.
Yes, so if you talk about the symptoms of HIV, it can be asymptomatic to the full-blown AIDS case. So if you talk about the HIV symptoms, as I mentioned, it could be asymptomatic. The person who might be staying in the society and being healthy, no other prior disease, without showing any symptoms. He might be having still HIV and living for many years without showing any symptoms. But with the passage of time, as immunity goes down, our CD4 cells keep on getting down, then patient will start throwing up the symptoms. It can be tuberculosis infection catching up, or it could be any fungal infection or any fever, and can be diarrhea also. So they are the symptoms which start coming up in the beginning of the HIV. And then down the course, if the patient falls in the category of a so-called AIDS, acquired immunodeficiency syndrome, in that condition, patient body weight is markedly loose, and he also has got the multiple infections in the body from head to toe. He might be or she might be having the n number of cancers in the body also, which are also known as AIDS-defining cancers. So this we all see from asymptomatic till the full-blown AIDS case.
So what are some common misconceptions about AIDS that are still, they still exist in the society and people, do not want to discuss, they get afraid?
I would say the biggest misconception is that if somebody gets diagnosed with the HIV, that it means there is no treatment or there is no cure. So I would talk about the cure. Definitely yes, as of now, the science has not made a cure part in the, I would say, current armamentarium. But yes, regarding the treatment, it is one of the best treatment available so far in the last many years. And many patients who are taking the ART regularly, and for last, we have seen many decades, they are living in healthy and good life without showing any symptoms. So if you take a single pill of ART, just like if you have an hypertension or any diabetes, you take a single pill and you stay totally healthy.
Okay. So, sir, talking about HIV/AIDS, how it affects the immune system if it remains untreated?
So the virus, what it does is the HIV virus, when it enters into our body, it tries to multiply and get integrated with our CD4 cells and start destructing the CD4 cells. And once the CD4 cells, which are our immunity providing cells, it gets low, our body gets open to multiple infections. So any kind of infection can be acquired, like in fungal infection, it can be tuberculosis, it could be infection in the brain, it could be infection in the bladder, it could be infection in the abdomen. So all these are, our body becomes susceptible to multiple infections. So HIV breaks the CD4 cells, and once the CD4 cells keep getting down, our body becomes open for many diseases.
Okay. So, sir, in that case, what are some sexual health tests, essential tests that many young adults skip but they must go through?
So, if you talk about the sexual health test, or I would label it as a sexual transmitted infections testing. So, in this, one of the basic tests is definitely yes, HIV rapid test or HIV ELISA can be done. And if once it is positive, further testing can be done for the confirmation. Other tests can be the for the syphilis like VDRL and TPHA testing is there, chlamydia, gonorrhea, herpes. They are the tests which should be done if there is some unprotected exposure with the unknown partner, or somebody is throwing up any kind of symptoms in the form of genital tract discharge or soreness. They should be testing for all these kind of STD syndrome testing.
Okay, so moving on, people are now curious about if there is any vaccine that can, reduce the risk of getting infected with AIDS, or specifically PrEP. So, why Indians are more, curious about this, and could you please explain this whole process?
So that's a very good question, ma'am. In the last many years, still I am practicing for this HIV disease. Many patients comes and they ask for the HIV preventive way or any kind of vaccination is there, even to make it eradicate or cure it. As of now, the HIV vaccine is still in the pipeline of development. It's not in the market. But yes, newer technology like CRISPR technologies are there, which have been tested in the patients who are having the lymphoma or leukemia along with the HIV. In those cases, there are almost 4 to 5 cases reported which have shown that the HIV has been eradicated from the body, but still not there in the practice because still in the phase 2 or phase 3 trial. Now, if I talk about the PrEP, that is a pre-exposure prophylaxis, we
Yeah,
should talk about
PrEP.
PrEP. So this kind of medicine is been given to the HIV negative person to prevent from the partner who might be carrying the HIV. So
Okay.
if you take your PrEP regularly, you have the chance of getting the prevention of HIV more than
So
95%.
it is a regular
It's
medicine
a regular
where
medicine
okay.
just to prevent it. It's a sort of a chemoprophylaxis, we say.
Okay.
So you need to take it and your partner is positive, who might be taking the ART or not be taking it ART, or your partner is unknown source. So if you take a PrEP regularly, you will not get a medicine, not get a HIV from your partner.
And what about the PrAP? I've also heard about it.
So one is PrEP,
Yeah,
another is the PEP, post-exposure prophylaxis.
post
If
exposure.
somebody has a bad night and had an exposure with the unknown partner, and in that condition, patient had a window period of 72 hours.
Okay.
In that condition, patient has to come to a doctor or HIV specialist. Within 72 hours, certain basic test has been done, and he has to start on a post-exposure prophylaxis, that is a PEP regimen, and within 72 hours. So if the patient takes for 28 days continuously single pill, the chances again is 95% of less getting the HIV.
And if a person is on ART, can
Yeah.
he still transmit the disease to their partner?
Yeah, it's a tricky question. I would say if the viral load is undetectable, it remains untransmittable. So here stands the concept of U equal to U.
Okay.
So undetectable remains untransmittable, but if the patient is not taking regular medicine regularly, is not having good compliance and adherent to the medication, in this case, the viral load will become on the higher side and he or she can transmit from one partner to the another partner.
Okay, so U is U, U is equals to U is
U.
the formula here.
Formula, absolutely, yes. And it holds true.
Okay, but now moving on, the biggest question, as I said in the beginning, is AIDS curable as of 2025? If we talk, is this disease fully curable?
It's not fully curable as of now if you talk about the current scientific data, but yes, it is fully treatable. If you diagnose all the kind of infections in the patient having the advanced AIDS, if the medicine has been started, what are the organ system which has been affected, if we start the medication, take care of all the vital organs, AIDS is treatable. Definitely, it's not curable. If you talk about the diabetes, which is we are the global diabetic burden of world. So diabetes is also a immunity lowering state. If you take the diabetic pill, control your blood sugar, you will become all right. Similarly, in case of HIV or AIDS also, if you take the ART regularly, your CD4 count is getting on the higher side, viral load is undetectable, you will be living a normal and healthy life like any other.
But so what are the scientific barriers that, are preventing a full-fledged HIV cure?
Yeah, so this is one of the biggest challenge is that the HIV virus, it's a very smart virus. What does it do? It get integrate with the human DNA.
Okay.
So whenever we start the patient on the ART, it kills the virus in the plasma, on the serum. But the original virus, which is the DNA, it is get integrated into the DNA of the human body. So once patient is off the ART, when patient is not taking the ART, this DNA get again off from the human body, start multiplying it, and again start going for the development of a virion or virus and that too in the ART free medium. So if you provide the ART, this will not going to multiply. But if once the ART is off, it's a very smart virus. It will come out
Okay.
and start multiplying it.
So that is like
So
a
that is why
hurdle.
there is also a problem in getting the vaccine. What will the vaccine do? Vaccine will have the antibody and that will kill the virus. But the virus is very smart. It goes and integrates into the human DNA. So it cannot kill that thing.
Right.
That's why.
But so now AI is everywhere, even in medicine and research. How do you think that AI and personalized medicine can, help in HIV/AIDS management in the upcoming decade?
So as I mentioned in the earlier also that the CRISPR technology. So CRISPR technology is one which is coming up. We can do the gene editing. So what we can do is the DNA which is of the HIV virus, it can be cut. Once it is get cut from the human genome, it is out of the cells. And in that condition, patient have the, I would say, regular ART and followed by the bone marrow transplantation. Then in that condition, the patient can transform into HIV positive to the totally HIV negative. If you talk about the AI in diagnostic or AI in the treatment,
Yeah, treatment
as a
process.
hardcore, AI will be definitely in getting the early suspicion of the HIV symptoms, early diagnosis, and patient can be managed without having the advanced, in the stage of the HIV, like AIDS. It can be diagnosed in the stage 1 or in the asymptomatic stage. So nobody will have the any opportunistic infection. So AI is a better tool for the early detection.
Okay.
And sooner the ART will be started and the patient will have a normal healthy life till 70 or 80.
So, sir, moving on, as I asked you in the beginning about symptoms. Now, a lot of people do not understand these symptoms and they go on to Google to search about it and they start to self-medicate, take medicines on their own. They do not want to consult doctor because they also get ashamed. They feel they do not want to discuss. They
Absolutely.
hesitate, as I said
Yes.
in the beginning. So, what could be the implications of this?
So one of the biggest thing is that somebody once get diagnosed, how he or she disclose to the close family members.
Yeah,
So that becomes the major challenge.
exactly.
So especially the I would say anyone who is from 18 years to till the down
Right.
60 70 years. So every strata has different challenges. But in that condition, we all know that it is one of the viral disease and it is fully treatable. It's not a curable, definitely, but fully treatable. Everybody has one or two close one who can somebody can share with that I have got this disease and I'm gonna consult one of the doctors of HIV specialist and soon I am going to start my ART. But the problem comes when nobody is there to help someone, when the stigma is there in the society. And once this stigma is not over, definitely anyone will have the fear factor that if I disclose to someone, will he or she be able to, digest this thing? Or might be, disclosing it to anyone outside the family members. So that's a major stigma. And people also fear that whether if I go to the doctor, whether this doctor will able to, I would say, take my confidentiality in a better way or not, because people have a number of questions. Because I have also encountered many of my patients, they say, sir, if you put us in our shoes, it's totally a different scenario. So whatever we're going to discuss, we have to going to discuss in a closed room.
Yeah.
And here I would like to suggest that the disease is in every strata, from somebody who is going in a pedestrian or till up to the who is traveling in a Mercedes. Everybody is having the disease. But the problem is that we need to understand the problem. We need to be a compassionate. We need to honor these people. And definitely, if the patient is being tried on the ART in earlier, he or she will be living a normal, smooth, and healthy life.
But sir, still it is being considered a taboo in the society. Why
Yes.
is it so? Why AIDS? People associate AIDS with a taboo.
This is what we need to break. That is why World AIDS Day, which we are celebrating now, it's not a day, one day conversation. It's a day in and day out. We need to honor these people. We need to fight against this stigma. Until the time we are fighting against this stigma or this is not over, our every day is an World AIDS Day.
Right.
Yeah. So compassionate action. We don't have to wait for the 1st December. It has to be on prevention, treatment, and dignity every day has to be World AIDS Day.
But sir, as we had a whole discussion about AIDS and all, one major thing is that people consider or people think that it gets transmitted, HIV gets transmitted only through unprotected sex. But
Yes.
what are the other ways? What are the other, pathways through which people might get infected?
So once you have already mentioned that's the unprotected sex, which is the one of the commonest route. Second is from the mother who is HIV positive to the growing fetus. Third is from the I would say blood transfusion. If the blood transfusion has been done, which has not been tested in a right way, it can also go for the getting the HIV. And the last one is from the sharing the needles, which can be infected. Like somebody is abusing the drug, or if going for a local quacks who is not using the sterile needle, it can also go for a catching the HIV or any other STDs.
And if a person has been infected with HIV/AIDS, he's going through the antiretroviral therapy (ART).
Yeah.
What are some lifestyle changes that can help him have a healthy life for like a long term?
Yeah, it's again a absolutely right question, need of the hour question. Here I would like to suggest that single pill is there these days, and it's the absolutely game-changing pill. And if you take a single pill, nobody can tell you that you are having any kind of disease or you are going for some any sort of a problem. So single pill daily, either in the morning or in the night, with food, without food, hardly matters. Single pill will make you totally healthy. You can take it as a, I would say, hypertension pill, or you can take it as a diabetic pill, or you can take it as a, I would say, immunity boosting pill. Single pill. You will not need any other pill beyond the single ART pill.
Okay, but sir, there are other concerns of the younger generation as well. Now, people are excited about tattoos, getting piercings done, but they're also, concerned about the injections there. So,
I would say in the last few months, I have also read about the many people are getting infected because of the
yeah,
tattooing.
exactly.
Sometimes hepatitis B, C, and even the HIV. They are definitely the risk factors are there. So whenever you are going for a tattoo, you need to make ensure the needle is been totally new, is been used, and it's totally under the aseptic and sterile conditions. You are making the tattoo because because putting something dye inside your subcutaneous tissue, and if something is going inside your tissue, it can definitely catch any kind of infection. So you need to make sure that the needle is totally new and it's in sterile condition is being used.
Okay, and one more, I would say, there is a misinformation, or I would like you to tell us, myth or a fact, that how HIV gets transmitted. People have this misconception that casual contact can also transfer HIV. So is it possible or not, like sharing food or hugging and all?
Yeah. So as we discussed about the four means of the transmission of the HIV, apart from that, there is no other means. I will repeat again. First is from the unprotected sex. Second is from the sharing the needles. Third is from the mother to the fetus. And fourth is by the blood transfusion. Apart from that, whether you eat together, whether you drink together, whether you are hugging, whether you are kissing, nothing can transmit.
So in kissing, for example, saliva is involved.
Yeah.
So can that act as a,
No, it can never be because our saliva doesn't contain HIV virus.
Okay.
Okay. So if you are kissing someone who is HIV positive, like mother is HIV positive, still fears that can I take my kid in my lap or can I go for a breastfeeding? So there are certain questions which comes into the mind of the even mother also. So this way you cannot transmit the virus from one person to the another person. So only four means are there. No other means has been there. Not even the mosquito bite.
Oh, okay.
Yeah.
So, well, that's important. Well, I guess we discussed all the important facts. What would be your message to the people on World AIDS Day?
So, World AIDS Day, this year the theme is overcoming, I would say, obstacles. What kind of obstacles is there? Recently, we have seen that the lot of curtails are there in the funding of the HIV. And what it will do in the overall worldwide globe wise, we have seen many clinics have been shut down who have been sponsored by some many agencies for the prevention, for the treatment, for the diagnostic purpose. These people require regular treatment, regular testing, and regular, I would say, care. And we need to honor them. We need to stop this stigma so that they should be having the good and better life.
Well, thank you, sir. Thank you for answering all our questions and thank you for giving all these suggestions. I hope our viewers liked it because you talked about it openly without hesitation, and that's the most important thing. So to our viewers, did you like this interview or not? Do comment and let us know. And for more such health related interviews, stay tuned with India TV.